Hi, I'm Michelle. I have JIA, which I've had since I was 8, so it's coming up to 30 years. My arthritis affects all of my joints, and I've had 2 hip replacements, 1 revision surgery, a metal plate in my wrist, and tendon reconstruction. And I have just had my first knee replacement. The problems with my knee started after I had a hip revision surgery a few years ago. And after that, I had quite a significant leg discrepancy. So I remember speaking to my rheumatologist and she referred me back to my orthopedic surgeon. My surgeon took one look at it and was like, I don't like that knee. It was at 30-degree angle. So I knew surgery was going to be the only option, really. When he told me we're going to have to do a knee replacement, I was a little bit dubious, but also pleased because I knew the result would be worth it. So my surgeon, he knows me, he knows my arthritis. And the thing with me is that when I get something going wrong, it goes downhill really rapidly. So being on a waiting list just was out of the question. There was already tailbacks from COVID. I actually asked him if it would be worth me going private. I knew that he did private knee surgery, so I'd be in good hands. But he said, no, we can fast track this because I know how detrimental it'll be to you. I was like expecting it to be in the next like 6 months, 6 to 12 months. And he turned around and said, we'll do it next month. I was kind of on the spot, like, oh, okay. I signed the paperwork there and then, doing the consent, popped off to pre-op, got all the blood tests done, more paperwork, questionnaires. In a way, I think it was better to not really have that long to think about it because I do tend to overthink. So I would have just thought about all the things that could possibly go wrong. But I think above all, I felt excited because I knew the benefits. I didn't really need to prepare that much to make my house accessible for a post-op situation because my house is already prepared for a life that needs accessibility. I live in a bungalow, but I knew that I would be using like a frame, a walking frame, and probably electric wheelchair. I've got this long rug, which is a bit of a death trap. So before the operation, I had to have this rug rolled up and put away because it would just end up getting eaten by the wheels of the wheelchair, or knowing me, I would trip on it and break something. So that had to go. Something that I got before the operation was a robot hoover, which I've wanted for ages. And then I thought, you know what, I'm going to get one. I don't really hoover that much anyway, so I love my robot hoover. One of the things that I love in my life is to have a cup of coffee in bed. When you have a knee replacement and you need to walk on crutches or you need to use a frame or you're in a chair, it's not so easy to carry your coffee back to bed. So I saw this on, it was like Gogglebox or something, and someone had it, and you put your cup on it and then you carry it. And then science means that you don't spill, you drink. So this a godsend. The morning of the operation, it was a day before my birthday, and I hadn't slept the night before, and I knew that I wouldn't. So I left all of the things that I needed to do before going into hospital until the night before to keep me busy more than anything. So I was just eating all the bits out of the fridge that would have gone out of date while I was away, like packing my bag. I made sure that I packed something really soft. So I had little pots of custard because in the past, when I've gone fully under, which I was expecting, and the tube, and then you get sore throat and all this kind of stuff, something soft was definitely better to have. You can't have ice cream all the time. I mean, we want to, but we can't. So I just took like jelly and soft things that you can swallow easily and feel nice. One of my big things is a snack bag packed full of cans of pop, cartons of juice, chocolate, biscuits, all those things that just make you feel better and end up getting crumbs in your bed. I suppose that was really the moment where I really started to think about what was going to happen and what could potentially go wrong. But I did that intentionally so that I didn't have ages to worry. It was a bit like, oh, well, it's too late now. I'm going in a few hours. I can remember my mum coming to pick me up to take me. And I think I was more excited than anything. I knew that I was first on the list as well. So as soon as I got there, it wouldn't be that long before I actually went down to theatre. So one of the challenges with me in surgery is putting me to sleep. I saw a specialist anaesthetist before the operation to talk about how they would put me under. There was a few different options. I saw the nicest guy ever, and he was so lovely and really took the time to explain all the different options, what he would recommend. And on the actual day when I had the surgery, it was a different anaesthetist, and he just did something completely different. So that really took me back. I'm one of these people that does advocate for myself, and I really try to help other people to have a voice and ask the questions, but you put your trust in the medical professionals. So that's what we did. They give you something to just make you sleepy. I was like numb everywhere. And they put this sheet up in front of you so you can't see what's going on. I don't really remember being in recovery as such, but I can remember being wheeled in my bed to my room on the ward and kind of looking around a little bit out of it and just thinking, oh, I'm done now. Okay, next. All of the doctors kept reiterating to me was how painful the surgery recovery was going to be. And I didn't know that before. I knew that there was going to be a long period of like rehab, but I didn't know about the pain. So that was a bit scary. They told me it would be at least a few days that I'd be in hospital after. They get you out of bed pretty quickly. So the next day I was up and out of bed, and then they wait for you to be able to do stairs if you need to do stairs with the physio, eat something, go to the loo, all the usual things that you kind of have to tick all those boxes and make sure that you're going to be okay to be independent at home. I think hospital food is always going to be questionable, and I was prepared for that. I had quite a long stay a couple of years ago, so by that point I'd memorised the menu. I knew what was coming, I knew what was safe to get, so you can't go wrong with jacket potato or a sandwich. You do reach a point though when you think, I never want to see another sandwich again. The only thing I needed was my phone. You can't go wrong with group chats, keep you up on all the gossip, see what's going on, and keep everybody updated. Taking a charger is essential, a long one that reaches from the wall to your bed. You just watch the clock and wait for visiting hours until someone arrives. Because it was COVID restrictions while I was in, I was really lucky. It just changed to one person a day for an hour, and you had to ring up and book a slot. That's always something that you count down to all day. And I thought a lot about like the people who were in during COVID and how they didn't have that at all. And I don't think I would have kept my sanity. Time slows down when you're in hospital. And I think especially when you're on your own, and because I wasn't in a ward, I was in my own room. If you've got the door shut, like you don't hear from anybody until they come in to pester you, to poke you with needles or take your blood pressure or do whatever needs doing. I was in hospital on my birthday. That was the first day when all the drugs are starting to wear off and I can start to feel the pain that they warned me about. And I just wanted to be out having a nice meal with my friends and my family and celebrating in the way that I normally would. But instead I got a new knee as a present. So win-win really. It ended up being probably about a week. I couldn't wait to go home. Honestly, I was ready, packed before they even said I could go, sitting on the end of my bed, waiting for my lift. I just wanted to be in my own space and do things in my own time and just have my stuff around me that I know and is familiar and is comfortable. Because I've had procedures before and I've been stressed about getting back to work or wanting to get back to work or go back to normal life. I feel like this time I tried not to think about that and I just really concentrated on the recovery because I wanted it to go as smoothly as possible. So I just wanted to do all the right things, eat lots of protein, do my exercises, use my ice pack. I was quite content really as soon as I got home. It was the summer, it was nice weather. My nephew could come and see me. I could just have a bit of a laugh with him. My sister, my friends and family was bringing me things, and prizes and flowers and loveliness. Tiger Cat lives around the corner from me and has been visiting. Whenever my back door's open, there's a cat in my house, and it could be in any room, wandering around like it owns the place. Other times it'll just be sprawled on my bed, or I'll walk into a room and there she is. But we have a little cuddle and she's my little pal. I expected the physio to be really intense and constant, but actually it was a lot more relaxed than I thought it was going to be. So you do quite a few exercises at home on your own at first, and that's just bending and stretching really to keep that movement. At that first appointment, the physio was assessing the range of movement in the knee, and I had a nice 90 degrees because I'd been a good girl and been doing my exercises at home. They just help you to build up your strength and make sure that you're doing your exercises in the right way and you're comfortable. And so apart from the stretching, we did a few things on a little bike and with like a long pole thing. But I always want to do more. So although she was telling me you've got 90 degrees, I was quite keen to push myself a bit further because I felt like I could. I didn't want to go too far and I knew not to overstretch, but I could feel it in me that I could go a little bit further and I wanted to. When that last appointment came for physio, I was really pleased, just freed up a bit more time.
Bye physio, thank you.
And just to know that my knee was done and ready for the world was brilliant. I think for my knee now, I don't even notice it. It's completely different to the pain that I had before. It's more mobile, it's not painful. Sometimes makes a little squeaky noise, but that's nothing to worry about. It has definitely made a difference to my daily life. When you're told that you need to have a procedure, whether it's a surgery or whatever, it is a big thing at the time, and when you're going through it at the time, it's a massive thing. But when it's all done and dusted and you reflect on it, it's like, oh yeah, I did that and now I'm here and it's better. And that's all that matters. I've got such a strong network around me. Just being there in any way that I needed was enough. Just asking how you are is enough. I'm very lucky. Having my mum come through every day, I just couldn't have lived without that. She is superwoman. I don't know what I would do without her. And she always has been ever since I was little. She's always looked after me. And I think everybody needs that support network around them. It's just so important to be able to lean on people and be able to ask them and trust them with something that's so personal and can be difficult. They just make it really easy.
Hello, come in.
Hello.
Have I got a better knee? Have a look. Not even my cat. One of the things I'm most excited about is being able to do this. My gorgeous neighbour Margaret and her husband Peter have just brought me round some tea. That moment when you can't remember what you ordered. Did somebody say, just eat? It's all healed. Yeah. The danger of having a wheelchair is it just becomes a clothes horse. My mum's best friend, who I'm named after. These gorgeous flowers. All my guys at Arthur's Place, who I miss so much. Getting a bit bored of the knee now. Butterfly just flew in my room. How we're gonna dance when my knee's all better.